Good afternoon, everyone. This is Dr. Paul. I'm going to be actually moderating myself as well now. Welcome to the press conference. I'm going to be just giving you some updates at this point with status quo in terms of our surveillance, and we're just busy preparing for our assessment centers, which we plan to launch next week. We'll have some more details a bit later in the call. Essentially, we're just trying to, a few things that I wanted to sort of say. Number one, we've been getting a lot of calls for clarifications as to individuals who are seen grocery shopping who are supposed to be isolated, and we get calls and this is happening across the province. And I just want to stress that when individuals are asked to self-isolate, we mean that, and in most situations, it's either they've come in contact with somebody or they've come back from, in this case, the United States, I guess, because everything else is not flying in here. And so they're asked to stay home, self-isolate, and that means arrived in Canada through whatever border you're crossing, either airplane or driving in, for example, and just go home. Self-isolate at home for 14 days. Do not stop off at the grocery store. Do not stop off at the pharmacy or anything like that. We expect you to stay home. Now, if you're in self-isolation, you can go to the backyard. You can sort of take a walk sort of in front of your property. As long as you distance yourself from others, that's fine. But going to the store or going to public places, you should not be doing. So many people have asked us, is this obligatory? Is there a way you can enforce it? And there actually is. But there's so many people that are coming, so it's impractical. But, for example, if there is an individual who had COVID-19 and was asked to self-isolate, and that individual refused to do so, I could order that. I can order a quarantine that could be supported by police and court orders and with all kinds of fines. So I think people should know that it's, although we're asking people to voluntarily self-isolate, in certain situations where we or I, as the medical officer of health, perceive that they present a health hazard to the community, I can order them to be quarantined. So with heavy fines and other repercussions, including judgment orders and so on. So I think I'd like to get that across to everybody. And I would appreciate if you would share that as well. The other thing that we see that I've gotten questions about and calls to our health unit is that, again, perhaps some establishments or other one of the establishments or entities that are listed to be closed under the provincial order, so maybe open, or people have questions about it being open. I just want to remind everybody that because this is a provincial order under the declaration of an Ontario-wide emergency, this is very clear now the jurisdiction of police. And so any calls that we get at the health unit, we will refer to the police, either the Cornwall Police or the OPP, depending on where they are. And so we're asking people to call the police directly because, again, the police are now mandated to be able to enforce the order under the provincial mandate, which is the declaration of the emergency in Ontario. And so this is what I just wanted to clarify, because we've been getting a lot of calls on that one. I've got some other questions that came from yesterday. People asked me about quinones using quinones in COVID. There's no studies. I know they're ongoing right now, but there's no evidence that says that they work. But people are looking, and I encourage them to look. In the States, they're doing some studies, and perhaps we can get lucky with one of these compounds that will inhibit the COVID virus. The other question that was asked yesterday was, what is the number of respirators that we have or ventilators that we have in our area? And through the Champlain-Lynn area, there's over 500 available in the area. 100 immediately available to the Cornwall Hospital, for example. That's higher because that excludes the provincial numbers. And another question that I got, actually, I'm looking at today is, can you repeat the latest understanding of percentages that end up requiring a hospital bed, and how many require intensive care and require a ventilator? So we don't have those Canadian data because it's we don't have as many cases yet. But I did pull out I'll just open it here. Actually a UK study that looked at it, and in terms of hospitalization and percentage of patients hospitalized, yes, it is roughly around, I would say 10 to 15% overall, but below 50 to 59, it's 10% or less. And as you get younger, it goes down to the 1 or 2% range. So you can see that in the younger they are, the symptoms don't require hospitalization. And then as you get older, you do get into the 16 to 17% range for 60 to 69-year-olds, and 25% to the 70 to 79-year-olds. And among them, the significant percentage, at least a quarter to 75%, depending on the age as it goes up, require critical care, with most of them requiring ventilatory support. So I just wanted to bring it back. That's a question that I had. I think it was from Nation Valley News. The other one that was asked by Nation Valley was, is the person who drove case number 2 to the testing center in Ottawa the man's wife? No, it's the man's son. And essentially there are 3 people: the man's son, the man's wife, and the case itself, who are isolated. The other question has to do with if Winchester Hospital Assessment Center is being planned. Yes, it is. We're actually right in the process of setting that one up, and hopefully we'll be launching it sometime next week. Again, the timelines are difficult to say because we need equipment to come in, and swabbing and testing and so on, but we're planning to do that next week, as well as looking at getting the Cornwall hospitals one ready for, again, we're calling them sort of assessment centers. Like I said, I think yesterday, we will be initially testing, but as we see cases develop in our area, in the future, hopefully not that many, but as we get sort of local transmission of COVID-19, it'll switch to a full-on assessment center where people with respiratory symptoms, not sick enough to go to the emergency room, who want to get a reassurance, will go to the assessment centers. So that's where we are with that. So we're looking at next week for those, including the Hawkesbury one as well. We will be releasing press releases very shortly in regards to those, and as they come out. And so stay tuned. But we are working diligently, and like I said, we're planning them. We're going to be identifying the locations have been identified. The trigger will be essentially overload of the hospital and or activity of COVID virus in our region. I have another one now from Francis who says, when are you starting to share more info without waiting for the province? I think at this point, we're in the process of, when we get cases, we will be moving forward and not have to wait for the province. I know that they've got a lot of cases pending. So it's a balance between working with the province and making sure that our media locally gets the timely information. So we're moving towards that. And over the weekend, although we don't have any media availability set out for tomorrow or Sunday. However, 2 things may happen. Should there be anything that occurs, we will issue a press release and or add an ad hoc press conference as well. So those are the questions that I've gotten so far that were sent to us by email, and the ones that I wanted to answer yesterday. So let's open it up to another 5 minutes or so, because I've got another call, to any questions we have on the line.
Dr. Paul.
Hi,
hello. Oh,
hi. Oh, sorry.
Okay, you go first.
Which one?
I don't know who's who.
Okay.
Okay, go ahead, whoever you are.
Okay, yeah. Hi, Phil Blanchard, Morrisburg Leader. So you said 500 ventilators approximately for the Lynn, but the Champlain Lynn, but that goes from Baynesville all the way up to Deep River. So do you have a more finite number for specifically the Eastern Ontario Health Unit and the 4 hospitals that are?
I only have one for the Cornwall area, Cornwall has access to about 200 of them.
200. Okay.
Yeah. So I will get more numbers. It's just that's kind of something that I know is being handled outside of my jurisdiction. It's not my purview. It's just I need to, it's important to know, and it's important to know that the ministry is looking at, again, ramping up those numbers.
Right. Well, and that's a concern that I have heard because, there are several retirement homes. There is an aged population especially in South Dundas and South Stormont, where you have people who've come here to retire, so they're more at the higher risk group for it. So if there is something, how prepared is it going to be for a treatment for respirator? So
I think, like I said, with those numbers, those are minimum numbers, and like I said, there's also a provincial surplus as well, provincial number as well that is being added to that. I'm just talking about the local availability. The other thing too is that there's also a sort of a inter-hospital transfer of the ventilators, depending, and some of the hospitals can also have access to their anesthesia respirators, because as you know, they've curtailed all elective surgery, and they're only doing emergency surgeries.
Okay.
Thank you. Please.
Hi there, it's James from the Review in Van Cleek Hill. We were given information here by the mayor of Hawkesbury this afternoon saying a specific location for a testing assessment facility in Hawkesbury. I was wondering, is there an exact date or time or when that's going to open?
We will be releasing a press release momentarily. We're just waiting to get it translated into French. We plan to open it next Monday. Okay. A press release will come out in the next half hour or so.
Perfect. Okay. Thank you.
But count on it next week.
Bill Kingston from Cornwall Newswatch. Dr. Paul, about your talk about complaints from people not self-isolating, can you quantify the number of calls you're receiving?
We haven't got that many, maybe 3 or 4, but I've heard it from all over my colleagues from all over Ontario. So I think that, and I'll be honest with you, Bill, I trust people. I think that people will do the right thing. But I think they should also know that if they're not collaborating, people will shame them, for lack of a better word. And there are recourses. Like if I find that it's an individual who's isolated and has COVID, I will act much more swiftly than if somebody was sort of outside of his front door. Don't forget, people can stand in the front door as long as they don't congregate with other people. That's the most important thing.
Okay, just a quick question. So just in the simplest terms, basically, correct me if I'm wrong, you either get a referral from Telehealth Ontario or your primary care provider in order to get a test, correct?
No, actually, what we're going to be doing with this, and we're going to be outlining it, we're going to be going through, you can go on our website and get just a self-assessment and some recommendations there. And we will be sort of telling people where to go, and we'll have our own kind of assessment center on our website as well, so people can go on it and say, what are the symptoms? What are we testing? Go there, that type of thing. So we're going to build it ourselves locally because the province will be doing it, but I want to make sure we have it for our local population as well.
Dr. Paul, Nick Sieber, Cornwall Seaway News. I was just wondering, do you have the numbers for how many people in the EOHU region are in self-isolation?
No, I don't have those numbers at this point. I know that we're the ones that we're covering in terms of the ones that we have tested positive and those those contacts. I do not have it because unfortunately a lot are traveling in and we don't have any record of those. So it's only the ones that we have come in contact through either directly through a case and the contacts. And so it's not. I don't have a precise one. I can only tell you the ones that we know of. I'm sorry about that, but unfortunately, that's going to increase. We're not going to be able to have more and more information because we're expecting sort of an influx of U.S. visitors, but of the Canadian people who are in the U.S. And we're expecting tens of thousands. So it'll be no way for us to be able to track them.
Okay, Dr. Paul.
One more. Yes.
Yeah, Dr. Paul, I was wondering about the overall number of sick that we would need to see before you actually stop testing and they become full-blown assessment centers as opposed to testing centers?
That's a very good question. It's not the overall number. It's the overall sort of feeling or from our surveillance that we're getting cases repeatedly. I can't tell you the exact number. We're actually looking at that with the ministry. But if we start seeing cases develop without, one case I'll take, but a couple of cases that have no travel history, I'm going to say at that point, well, we've triggered it the other way. We've got it in our community. Let's move forward. So it's a good question, but it's hard for me to answer.
Right. Testing becomes moot at that point.
Yes, exactly. We're going to assume you're a probable case, and then we'll do the same precaution. Stay home. And at that point, we're not going to have criteria for testing. We're going to have criteria for either you go to emergency, either you stay home, or if you're worried, you go to the assessment center so somebody can listen to your chest to ensure you're fine. That's how it's going to break out to.
Dr. Paul, une dernière question en français. Combien de tests sont effectués chaque jour dans les centres de dépistage aujourd'hui?
On n'a pas de centre de dépistage encore. Le centre de dépistage va commencer la semaine prochaine.
D'accord. Et dans les hôpitaux, alors, dans les quatre hôpitaux de la région, combien de tests sont effectués chaque jour?
On n'a pas. Je peux vous dire que c'est pas plus que 4 à 8 de chacune, mais ça, je veux deviner parce que j'ai pas les statistiques encore. Nous, les résultats qui nous viennent, c'est plutôt les résultats positifs, pas négatifs. Mais on a ces détails. Je les ai pas encore. Mais nous, ceux que nous appartiennent beaucoup, c'est plutôt le chiffre positif.
D'accord.
That's it.
Oui,
So I gotta go. Yes, I got one more.
Oui, une dernière question. J'aimerais simplement savoir les centres de dépistage qui vont commencer la semaine prochaine. Ils vont être où?
Ils vont être. Non, on va avoir. On va commencer avec une la semaine prochaine sûrement et probablement 2 ou 3 autres la semaine prochaine aussi. Nous avons des planifications d'avoir jusqu'à 5 dans notre région, mais comme on va voir, ça va dépendre le débit de l'utilisation à la salle d'urgence. Mais je peux vous dire que la semaine prochaine, on va en avoir. Bientôt, on va avoir une release de press release bientôt pour qu'on puisse partager avec tout le monde.
Puis le lieu du centre de dépistage va être dans le communiqué?
Pardon? Oui. Je peux vous dire, ça va être à Hawkesbury, ça va être à Winchester, ça va être à Cornwall, bien sûr, et on a des plans pour Alexandria aussi. Mais les lieux, les adresses vont être disponibles très bientôt.
Parfait.
Thank you very much, everybody. I've got to go. Thank you.
Thank you.
Merci.
Bye for now.
Thank you. Bye.
The leader has